Today, I'm speaking on teen depression and the experiences I have had with teen depression. As a teenager and young adolescent, I suffered with depression. The depression was mild, and it came and went depending on the situation I was going through at the time. I never sought help, nor was I ever approached by a loved one or a friend on my depressive behavior, because I always wore a great smile to cover up any signs of despair. I was not always depressed and do have happy memories from that time era. However, by the age of 29, I began to experience severe anxiety attacks. And by the age of 38, I was so depressed that my smile no longer worked on fooling others. I could not even fool myself any longer. Also, at the age of 38, I went to the doctors and was diagnosed with severe depression. Not the on and off again mild depression I once had years ago, but severe depression. I started seeing a counselor who told me that the untreated experiences I have endured as a young child affected not only my self-esteem, but also contributed to the anxiety and depression I had had. I basically took all the negative factors right into my adulthood, letting them control me. According to an internet article titled Understanding Depression, provided by kidshealth.org, as many as 1 in every 33 children may have depression. In teens, that number may be as high as 1 in 8. Those numbers are alarming. So if 1 out of every 8 teenagers suffers from depression, that is like saying a typical classroom of 30 children, 3 of them are suffering from depression. Now, I know from experience that depression can creep up slowly, and the person may not even realize they have depression until it hits them with full force. Today, I will tell you first about depression, and second, the signs and symptoms of teen depression. KidsHealth.org defines depression as a depressive state or mood lingers for a long time, weeks, months, or even longer, and limits a person's ability to function normally. Now, I know the feeling of a depressive state that lingers and never goes away. I know the feeling of having a teeny bit of happiness enter my mind. And as soon as I felt that hope of happiness, it was replaced with real fast with gloomy, depressing thoughts. I remember those moments clearly. I would say to myself, hey, why are you smiling for? It is only a temporary happiness. It was a difficult time in my life, and I was an adult. So imagine how difficult it is for a teenager, especially in today's society, to battle with depression. The National Center for Biotechnology states a total of 13 to 20% of children living in the United States experience a mental disorder in a given year. And surveillance during 1994 through 2011 was showing the prevalence that conditions to be increasing. Suicide, which can result from the interaction of mental disorders and other factors, was the second leading cause of death among children ages 12 to 17 years in 2010. Some people who lack an understanding of depression may ask what can possibly cause a teen to feel so hopeless. According to an article on WebMD.com, teens can develop feelings of worthlessness and inadequacy over their grades, school performances, social status with peers, sexual orientation, or family life can each have a major effect on how a teen feels. Sometimes teen depression may result from environmental stress. Knowing the signs and symptoms is important and can help a teen to avoid high-risk behaviors. So let's take a look at WebMD.com information on the signs and symptoms of teen depression. Apathy, complaints of pains, including headaches, stomach aches, low back pain, or fatigue, difficulty concentrating, difficulty making decisions, excessive or inappropriate guilt, irresponsible behavior, for example, forgetting obligations, being late for classes, skipping school, loss of interest in food, or compulsive overeating that results in rapid weight loss or gain, memory loss, preoccupation with death and dying, rebellious behavior, sadness, anxiety, or a feeling of hopelessness, staying awake at night and sleeping during the day, sudden drop in grades, use of alcohol or drugs, and promiscuous sexual activity, withdrawal from friends. In addition to those signs and symptoms, depression can be hereditary. I spoke earlier on my experiences as a teen with depression, but I also have experiences with my teenage son, who has suffered with depression. On Livestrong.com, there is a 2007 article titled Hereditary Factors of Depression. Such article states, individuals with immediate family members who suffer from depression have a 15% risk of developing depression. Individuals with no family history of depression have a 2 to 3% risk of developing depression. This is a picture of me and my son when he was a child. He was so happy and silly and carefree. I have tons of those types of pictures. However, in the last few years, I do not have as many pictures of my son wearing that awesome smile. It is heartbreaking to know life's challenges can overpower our teens' minds to the point they are depressed and give up on themselves. The youth of today are our future generation, so even if there was only one teenager per state who suffers with depression, that is one too many. Every youth deserves to be happy. Because of my personal experiences and my desire to help others through various situations, is why I felt the importance to share my experience and inform on teen depression, not only for the youth, but also for those who love them. Thank you for your time, and I look forward to any questions you may have.